Let's continue our series on setting up your dental photo equipment correctly. We covered Sony A7C II, let's say the whole Sony universe, the Canon universe, and now let's jump into the Nikon system, the Nikon ecosystems. Check also out the free dental photo Bible, where I give you an overview of the equipment you need, what lens to buy. The lens is the most important thing, the macro lens, what flashes to buy, what cameras to buy, and also how to set up these cameras correctly. But now let's talk about Nikon. I'm balancing between using the APS-C Z50 II, which then with the 105mm Nikon macro lens gives you a longer working distance, more depth of field, better light control. But you can also use a full frame camera like the Z6 II or Z6 III, really great cameras. And sometimes I even use the full frame camera in crop mode to get more working distance and better depth of field. So this is an option that is interesting. You can use your full frame camera and shoot also in crop mode to get more working distance, to get the APS-C sensor advantages without losing quality. We don't need huge files for our dental photography anyway. The Nikkor lens offers an LED screen to show all the information. That's a different approach to Sony or Canon, but very nice. The concept of having a screen on top of your lens, and then again, holding your camera with the left hand. Here I have combined it with the Godox MF-R76C flash. You can also go for, you already know, the old bracket and the MF-12 flashes that can be mounted on the same setup. But we will talk about that later. Also about accessories that you might need. My favorite accessory, my cheek retractors, double-ended, stainless steel, small and large, and they fit perfectly in your mouth and have also space for mirrors. You see the mirror is slipping between the retractor. So this is really a great tool, but we will talk about the accessory in separate videos. Before we jump into some additional tips and tricks, let's check out how to set up your Nikon camera correctly and save the settings U1 for intraoral, U2 for portrait photography. Let's go. Now that you have set up your Nikon camera correctly, again, I used to work with the viewfinder on this camera. It's okay because the viewfinder is in the axis of the lens. So if you use the viewfinder, you have a good feeling of the orientation. But also with my Nikon setup, I'm switching more and more using just the back screen, focus peaking to get a pre-focus, then moving back and forward until I see my red. Again, red is my highlight color for the peaking, where I can set where the focus is and then push the button, check the result. This is really easy. Again, tripod, left hand is my left arm is my tripod, and also is used to manipulate the lens, and the right hand always having eye contact, patient setup in the chair. These are the important thing. And again, also here, you can use my beloved old bracket with the MF-12 flashes, where you can transform your lateral into ring flash just by turning around the flash heads. We also talked about diffusers. I have a separate video on diffusers, soft boxes. I love the ones from Intra Photos. They attach magnetically, or you can also use the Godox ones that just clip on. So they are a little bit smaller, more compact. Again, personally, I prefer not to use diffusers on my camera. I prefer to work with positioning the light and avoiding harsh reflection just by moving the flashes more outward, and then balance the light and get the light effect or the light reflections that I'm using. As a trigger, also here the Godox X3 trigger to fire my Godox flashes, and bouncers like this one from Sexy Ceramic that now they are magnetically attached. And also something that I will talk about is cross-polarizing filter for the MF-12, available from Pro-Dental Photo or also Intra Photos. Again, we'll talk also about diffusers, but this is all in a separate video